So first, what's ambient scribe? It's basically automatically transcribing or translating what happens in the exam room into a clinical document. So we'll start with an audio recording of that conversation. We'll use AI to translate that into a transcript, then use AI to turn that into a clinical document, a progress note often. But what's the problem to solve? What's the underlying need? What we'd like to do is have an accurate rendition of what happened in that exam room. That means we want to see the information that was uncovered during that conversation. We want to understand the rationale for the physician making recommendations, what was the decision-making process, and what were the plans and the expected output. Why? Because the next person who sees this, could be me, could be others, wants to know what was planned, what was expected, and if that didn't reach the expectation, what do we do differently? So what's the problem? The problem is this has turned out to be a burnout process for docs. Why? It takes us a lot of time. You all know from your example, from your own experience with the doc, half the time the doc is looking at the computer, just as that diagram that Bob showed, rather than the patient. And half that time or more is dealing with these clinical documents, either foraging for the information we're looking for or creating more documents for other people to forage in. Now, that causes a cognitive burden, and that leads to that psychological burnout problem. So AI Scribes is trying to help that. How's it doing? Well, it turns out it does quite well in terms of surveys of physicians' perception of their burnout. It has reduced in one study from 52% to 39%. Different question whether we want 40% of our docs to be burned out, but it is definitely better. What about the time piece? Not so much. Maybe save 30, 40 seconds per note, and in some studies not even statistically different.